Hey everyone, I'm Mackenzie.
I'm Annie.
And I'm Katrina.
And here's an awkward selfie of us to start our project.
Our hearts have a super important job. Every day, they pump over 100,000 times, working like perfect machines to keep our bodies supplied with blood. However, like other machines, they sometimes malfunction. And when this happens, they must receive outside assistance and undergo repair. This is when we need the LVAD. The left ventricular assistive device, also called the LVAD, is used to temporarily support the pumping action of the left ventricle in patients whose hearts have malfunctioned or failed. It shunts blood from the left side of the heart through the device and then back to the aorta, thus supporting or replacing the action of the faulty ventricle. An LVAD system has four main parts, and it may be positioned either externally or internally. The first part is the heart pump, which is connected to the left side of the heart and actually moves the blood from the heart through the pump out to the rest of the body. The second part, the batteries, provide power when the system is not plugged into an outlet. The third part, drive line, transfers power and information between the controller and the heart pump. And the fourth part, the controller, which powers and checks both the pump and the driveline and alerts the user to how the system is working. The LVAD is used for support in three types of situations: when the left ventricle requires support while recovering from injury, when a patient must be stabilized before surgical repair of the heart, and in the situation that we'll be focusing on today, when the heart has failed and the patient is awaiting transplantation. So what exactly is heart failure? Well, put simply, it's the inability of the heart's ventricles to pump enough blood to meet the oxygen needs of body tissues. Heart failure can be classified in a number of different ways, and the type of failure determines the symptoms that occur. Today, we're just going to be looking at left-sided heart failure, since that's the type that the LVAD is intended to treat. Left-sided heart failure is the most common kind, and it occurs when the left ventricle is unable either to push blood out effectively or to relax enough for blood to fill it. As a result, the blood backs up into the lungs instead of being ejected into the systemic circulation. Thus, the main manifestations are related to the lungs, such as congestion, pulmonary edema, difficulty breathing, tachypnea, lung crackles, and blood-tinged sputum. Heart failure can also be classified as either chronic or acute. Acute heart failure is the sudden onset of signs and symptoms of heart failure, and it requires urgent medical care. The most common finding with this form of heart failure is pulmonary congestion. Chronic heart failure is progressive worsening of the ventricular function that results in ventricular remodeling. Eventually, it actually changes the size, shape, and the mechanical performance of the ventricle. Some of the leading causes of heart failure include hypertension, coronary artery disease, including myocardial infarction, rheumatic heart disease, pulmonary hypertension, and valvular disorders. Heart failure can also be caused by congenital heart problems, myocarditis, hyperthyroidism, and even viral infections and substance abuse. So how do we diagnose heart failure? Well, we start with a thorough history and physical examination to determine the underlying cause. Then we can also use blood tests to check for our cardiac biomarkers, BNP levels, a complete blood count, and a lipid profile. We can also use kidney tests, liver function tests, and urinalysis. Other tools that are used in the diagnostic process include chest x-rays, 12-lead EKGs, echocardiograms, nuclear imaging studies, and cardiac catheterizations.
With the use of LVAD, it is important to be aware of ethical issues and maintain Christian caring. Complications due to LVAD can adversely influence quality of life for patients and caregivers. The caregivers of recipients may experience significant burden, such as poor physical health, depression, anxiety, and post-traumatic stress disorder. Risk and benefits of LVAD and consequences for end-of-life trajectories and care can be a conflict with patients who do not wish to be put on assistive devices to live. Some nursing priorities would include assessing mental status and skin would be the best indicator of oxygenation and perfusion. Do not perform CPR on LVAD patients. Chest compressions should not be performed due to potential damage to the inflow cannula directly beneath the sternum. Sterile dressing changes should be a priority to prevent infection or skin irritation. Patient training is very important. They should be taught how to be independent and provide self-care.
Nearly 6 million Americans suffer from heart failure. Heart failure can't be cured, but it can be managed with medications until it reaches an advanced stage. At that point, a heart transplant or an implanted left ventricular assist device, or our LVAD, is the only long-term option for survival. An LVAD can either be a bridge to transplantation or someone's destination therapy to reach their best quality of life. Caring for the hospitalized patient with an LVAD begins with a thorough assessment of both the patient and the LVAD separately. Monitor the blood pressure and mean arterial pressure, the MAP. The goal is 60 millimeters of mercury to 90 millimeters of mercury. An elevated MAP decreases the flow of perfusion, and if the MAP is too high, the patient may require antihypertensive drugs. Some of these antihypertensive drugs include metoprolol, hydralazine, and isosorbide dinitrate. These drugs may need to be adjusted until the goal MAP is reached. Always check with the provider before holding any medications due to a low MAP. You can find your MAP by subtracting your systolic blood pressure from your diastolic blood pressure. The LVAD requires a regular care and system checks, including power source changes, daily self-tests, and driveline dressing changes. Performing these tasks in the hospital provides teaching opportunities for patients and caregivers. One of these things that's super important is the 4 Ps of the LVAD. The LVAD may be connected to the power module, which is plugged into the wall, or to allow more mobility, the patient may wear the batteries in a holster. When the device is plugged into the module, several numbers on the system monitor indicate pump flow, pump speed, pulse index, and power. It is important that the patients understand these measurements and learn them as they go. Teach the patient to perform a daily self-test to ensure the LVAD is working properly. When the patient presses and holds the battery button on the system controller, the screen displays self-test. If the panel is working properly, the audio alarm will sound and control panel alarms will light up. These alarms include power and battery alarms, a red heart hazard alarm, and a wrench advisory alarm. It is important to assess the driveline site during each patient assessment, or more frequently if you are concerned about dislodgement. Except under special circumstances, the driveline dressings must be changed daily or every other day, depending on the provider's order and how long the patient has had the LVAD. Ultimately, you are responsible for ensuring the dressing change is completed. Caregiving can be burdensome. Many caregivers express fear of the LVAD, regret taking on the role, or experience depression and anxiety. They need support. Even if the patient has had the LVAD for a long time, provide caregivers with resources for support groups where they can receive encouragement and respite care. Other nursing priorities include looking for complications as well as infection signs. Some common LVAD complications include infection, pump thrombus, hemorrhage, arrhythmias, and suction events. Another nursing management criteria is to treat the patient and give psychosocial support, because you never know what a patient is going through when they have an LVAD. As the population of patients with advanced heart failure increases, nurses in all healthcare settings need to become familiar with the care of patients with LVADs, including device assessment and management, potential complications, and patient and caregiver education and support. Caring for the patient with an LVAD can be challenging, but I'm sure it's also immensely rewarding. And here's a blooper of what it looks like after spending 4 hours in the library study room.